And do you find sort of the intuitiveness of the platform itself, and even when it comes to things like heart and lung scans, the AI involved, do you think that lowers that that fear? Do you think that that kind of gives people more confidence to really dig into this and get all ultrasound is worth out of it?
I think it does, at least from what I've seen. I think it does in the biggest fashion for the young, like the students that I've used it with, because it's like a contest for them.
Hmm.
Like being able to have like a really easy AI algorithm that gives them EF. And then so my challenge to them or anybody is always, you don't do this until you've decided what you think it is. And you can do, we teach them a lot of different ways to do it, like systolic function, like fractional shortening or E-point septal separation and different methods. But I always tell them, like, you figure it out, put it in your head, and then do it. And then it's almost like it's like a second layer of learning that, typically what will happen is they'll do the image on a regular equipment. They'll fill out a report. And so they'll put what they think it is in the report. And we give them like ranges. We don't ask them specifically what's this patient's ejection fraction. It's above 50, 30 to 50, or less than 30. That's how our reports are structured. And so a week later, we'll have rounds with them, and we'll look at their images in my office or one of our other faculty's office, and we'll go through it. But this is a week later, and so their knowledge or memory of it, when they get to the time to have the gold standard, which is us telling them what it is, it's now a week later. It's not as impactful. But when they get to do it and then have the gold standard happen like instantaneously, it really like enhances the learning, because then they can take that knowledge, which now it's not just them calculating systolic function, it's them doing it, them seeing the algorithm doing it, like creating like a new like frame of reference between those two data points and moving to the next case 5 minutes later. And now they're a better sonographer, they're a better interpreter. And so even with like the feedback of the image quality too, right? You can take that to the next patient and you become better quickly. Like your learning curve, we think, and it's actually a study that I've written up and I'm trying to get through our IRB, is to kind of assess the learning curves of these student learners who are exposed to this AI enhanced educational program versus our standard program with the carts and the weekly review. And that's what I see empirically, is it takes like months of learning and compresses it into a much shorter period of time, because you get that like next layer of the AI like right then and there. And it really drives the learning home for the student.